warahmatullahi wabarakatuh. First of all, let me introduce myself. I am Chelsea Fabria and I am from KC class. My study ID is 2501H073. And this video is about my final project, Basic Listening. The topic is health and health problem, and I will talk about stroke. First, we will talk about understanding a stroke. A stroke results from a sudden depression of blood flow to the brain, and there are two major types of stroke. Ischemic stroke is the one that results from a blood vessel being occluded or plugged by a piece of a blood clot. Another type of stroke resulting from a rupture or a burst blood vessel in the brain. That type of stroke is called homogenic stroke. Human brain is a very needy organ, and that's why it requires a high blood clot traveling to the brain vessel and using its brain cell begin to die. This can happen within minutes from the blood flow disruption. Second, we will talk about stroke risk factor. Stroke is just a tip of an iceberg. It's not a disease in itself. It's a manifestation of an underlying problem in the body. The most common risk factors for stroke are conditions that are well known and highly treatable. Those are high blood pressure, diabetes, high cholesterol, smoking, and excessive alcohol use. One of the most common mistakes people do is they wait for the symptoms of stroke to go away. In neurologic saying, time is brain with every minute passing by brain cells are dying and causing irreversible damage to the brain. Another common mistake people make is taking aspirin like they would for a heart attack. In stroke, this is wrong and potentially dangerous because, as we have learned before, not all strokes are created equal. In case are you having homogenic stroke, not an ischemic one. This could be a dangerous and potentially a deadly mistake. Instead, get yourself into the hospital as soon as possible. Next, treatment and recovery. When your stroke is diagnosed and managed in a very early stage, the doctor will formulate a personalized plan for your profession, treatment, and recovery. You will also likely require physical occupational or speech therapy to help you recover after stroke. It is very important for you to stay in touch with your primary care doctor and with your neurologist to help you in your recovery. Stroke in women. Is stroke in women and men are different? The answer is yes and no. No, because stroke is large depends on the area of the brain that is being affected either by ischemia or by bleeding. So in the way, whether you experience difficult speaking or paralysis, men and women experience stroke very similarly. However, women frequently experience stroke in a different edition. Women are often stroke primary caretakers for others. They tend to underestimate the safety of their stroke and underreport them. Even medical professionals underestimate symptoms of stroke in women. This leads to misdiagnosis and worse outcomes of the stroke. Stroke in young adults. It's fundamentally unfair to have a stroke when you are young, otherwise known to be healthy. And the most common risk factors for a stroke in young adults are the usual suspects: high blood pressure, diabetes, high cholesterol, smoking, drug use, infection including COVID, exposure to OTC health supplement, energy drinks. Preventing stroke. Preventing stroke is easier than we think. Following decades of research, the American Heart and American Stroke Association professionals developed a simple formula called Life Simple 7. This is a set of measures that they propose to prevent heart diseases and stroke. Stop smoking, manage blood pressure, eat better, control cholesterol, get active, reduce blood sugar, and lose weight. Okay everyone, thank you for watching and see you!